Hey folks, I just wanted to give you an update on my status for this week. I think it was a pretty good week. I had a follow-up visit with my oncologist and urologist this week as a 6-week follow-up from surgery. We went over my recent PSA test, which came back as PSA undetectable. The reading on the chart was less than zero point 0.1. And so the doctors were excited about that. I was excited about that. And as the doctor explained to me, that means that, they did get all the cancer. However, we're still in a watching period for right now before they will um, go near the terms cancer free, and it makes sense. So what I have to do now is take that same test every 3 months for 2 years. They say typically the industry standard was the test is repeated every 3 months for a year, but at work, the doctors where I go, they just do it for extra year just to make sure that nothing creeps up during that extra time period. Then after that, it'll go to annual. So I'm excited about that. I'm looking forward to just continuing that part of the process. They were excited and I was excited. I also was um, released to actually start to pick up more activity. Like the doctor said that I can start to cut the grass myself, which that's awesome. So actually this week I did cut the front yard, and as he told me, take a small break, then I can do the back. So pace myself. I was released to do things like use my elliptical, um, very light weight training. I can do any kind of weight training as long as I'm using light weights and I'm not doing anything that's that's impacting my core. So things like push-ups or bench presses and things like that where you use your core. I'm not allowed to do those kinds of things, but any activity with moderation. So I was really happy about that. Um, the one thing that did come up was the bladder issue, the leakage, and so forth. What the doctor told me in that regard was that, well, I am only 6 weeks off from surgery. They do their data analysis for 12 months off from surgery, with the typical person actually finding themselves able to fully control their bladder within 3 months to 12 months. And since I'm only halfway to the 3 month period, I still have a little ways to go. So they just told me to be patient, just monitor it, just keep doing my Kegel exercises and be consistent and diligent. Exercise when I can and things of that nature. So I'm going to keep up that pace. One thing that they were concerned about, he said I was doing too many Kegel exercises, because honestly, I'll do them sometimes now without thinking about them. And when I started tracking it, I would do upwards of 300, 500 a day easily. So he wants me to cut that down to around 60 to 100, which is fine. I'm going to do what they say, give it a shot. I asked about physical therapy to help strengthen the pelvic floor region. And the urologist, oncologist told me that they definitely would write a script or whatever to allow me to be able to go to physical therapy anytime I would want to. But they said since I'm still in the healing stage, they would like for me to wait to my next checkup 3 months from now. And if I'm not any better, if the bladder issue hasn't resolved itself, then that probably would be a more appropriate time for me to go to physical therapy for it. But so to just wait. However, if I should decide that I just want to go, if I want to go tomorrow, they'll write the order up so that I can get in. So I'm going to take their advice and wait. They're the professionals. Um, One of the things I just have to keep in mind is that I have to slow down. I have to take my time, and I got to let my body heal. People keep saying, "Oh, you look strong. You look like you're back to normal." I can tell you physically, I'm not. Mentally, I'm not. I'm just not there yet. It is a long road to recovery, and part of the challenge is just staying humble and staying mindful that I can't do the things now physically that I was able to do, before surgery. I got to give my body time to heal and let it take the time that it takes so it heals properly, so that I don't have any further setbacks and issues and things of that nature. So overall, it was a good week. I'm gonna just keep pressing forward, keep doing the things that I know I need to do, keep working on my diet, keep working on my exercise, keep working on my mentality, my spirituality, and just I'll keep you guys updated as to the progress. But right now, you know, um, I just want the bladder issue thing to get taken care of, and there's nothing I can do about it but be patient and wait. And it's kind of hard sometimes because we're used to being in control, we're used to being able to do things, do what we want to do. And right now, my body is saying, "Hold up, you can't do the things you used to do right now." But I believe I'll get back to it. I just have to stay the course. So I hope this update helps somebody that might be coming along in the process. I hope that somehow this video encourages somebody. I hope that I can be a resource to somebody that just might need that sounding board. So in any regards, again, I just wanted to give a quick update as to the progress 6 weeks out. I have another appointment with my doctor 3 months from now. So far, so good on the PSA, and I just got to stay the course for the bladder issue. If there's any questions or comments, just let me know. I try to respond. Other than that, I hope everybody is doing well, and I hope everybody is having a blessed day. And I ask God to bless you and keep you all. Amen.